warahmatullahi wabarakatuh. We are these days working on unit number 5. The last portion, skeletal system, support and movement, actually the heading. In the support and movement, we are nowadays working on the support portion. So in the support lesson, axial skeleton is already over. Now we have to work with the appendicular skeleton. Ending axial skeleton, we have to start with the appendicular skeleton. Appendicular skeleton starts in the page number 23. In the appendicular skeleton, already I think I have covered pectoral girdle and pelvic girdle. So today in the lesson, we are going to start the upper limb. If you take upper limb, there are 30 bones making the upper limb. Altogether, there are 30 bones making the upper limb. And the bones are these. Okay, in the upper arm, this is the upper arm. Okay, there is one bone making the upper arm. That bone is humerus. Forearm. If you take forearm, two bones are making the forearm. One bone it is ulna, and the other bone it is radius. These two bones are making the forearm. Passing that, the wrist region has 8 kuti bones called carpals. 8 bones are there. They are carpals. Following the, so you can mark them, humerus, that is the upper arm, ulna and radius making the forearm. Wrist is made by the carpals. 8 bones are there. Have you marked it?
Yes, sir.
Yes, sir.
And followingly, metacarpal, that is making our palm, the palm region, our palm region. The bones in our palm region are metacarpals. We have 5 bones in the palm region, 5 metacarpals are there. And the fingers are made of pieces called phalanges. 14 phalanges we have. So, humerus bone is 1, ulna 1, radius 1, carpals 8 bones, metacarpals 5 bones, phalanges 14 bones. Totally there are 30 bones there. Complete it.
Done, sir.
Shahika, completed it?
Yes, sir.
Good. So, if you take our upper limb, okay, in the upper limb, various functions are there. Grasping, you know, grasping, when you tightly hold and pull something, that is grasping. Okay, with tightly holding, grasping, weightlift, and various movements are there in the so to support the various movements, in our shoulder, there is a joint. Here I am taking this shoulder joint. When you consider the shoulder joint, the shoulder joint is created by the head of the humerus with the scapula. Who to make the shoulder joint?
Head of the humerus and scapula.
Head of the humerus and scapula. If you see scapula bone, in the scapula bone, you can see this picture. This green color portion is the scapula bone. This place is called glenoid cavity. It is called glenoid cavity. Look at the glenoid cavity. Is it a deeper one or a shallow one? Is it a deeper one or a shallow one?
Shallow one.
A shallow one. Okay, it's a shallow one. Now, if you take our pectoral, pelvic girdle. If you take our pelvic girdle, okay, in the pelvic girdle, also there is a glenoid cavity. You can see this glenoid cavity. Here is our legs articulation place, that is glenoid cavity. What about this glenoid cavity? Is it deeper or shallower?
Deeper.
It is deeper. So, if you take the hands movements and legs movements, hands can move in different directions in different ways that cannot be done by the leg, correct? Like you
Sir.
move your hands, can you move your legs?
Can't, sir.
Can't. Main reason, the depth, one of the main reason is the depth of this glenoid cavity. So this is also a glenoid cavity, and it is getting a special name called acetabulum that we will later discuss. Acetabulum. So I need just a comparison. I need just a comparison between the two. Okay. So here it says, okay, who two are making the shoulder joint. One, it is this head of the humerus. Other one is the glenoid cavity of the
Scapula.
scapula. In the joints in our body, there are different joints there. One, it is called ball and socket joint. Ball and socket joint. This is one kind of joint in our body. There will be a ball-like structure which is fixed to the socket part and moving. There is, okay, what kind of joint? What kind of joint it is?
Ball and socket
Ball
joint.
and socket joint. There's another joint. It is called pivot joint. Okay, pivot joint is in our elbow. Okay, you can move the elbow only in one way. You can't move your elbow as you wish in all the directions. You can move your elbow continuously only in one direction. That is pivot joint. So various joints are there. Here, the joint in the shoulder, how does your book describes it?
Incomplete
It's
ball
an
and
incomplete ball and socket joint. It's an incomplete ball and socket joint. In this joint, various movements can occur. What are the movements mentioned to you here?
flexion, extension, adduction,
Adduction,
rotation, circumduction.
circumduction, flexion, extension, adduction, abduction, rotation, and circumduction. Okay. So if we search for movement in shoulder joints, okay, movements in shoulder joint, they will show you all these. Even some more things are shown to you. If you take the way you move your hand, you can see abduction. Actually, see here, if you are, you can understand how what is flexion, what is extension, What is abduction? What is adduction? Okay. What is rotation? Okay. What is rotation? Okay. Circumduction is not shown here. Circumduction can be seen in a person who plays cricket. Okay. Circumduction. Circumduction you can see in a okay this kind of a movement. Okay, circumduction. So various. This is the real circumduction. Cricket bowlers, you would have seen how do they. Okay, how do they move their hand? Circumduction. Okay, circumduction people, they move the hand like a circle from front to go be the hand will go behind and come to the front. Is circumduction. Right? Now see, if you take this one, this man will move his hand in this manner. Correct? Am I right?
Yes, sir.
That is called circumduction. Right, like this, there are various movements there. We don't need to know individually, but without meaning, those words are useless. Right. If you take the humerus bone, okay, if you take the humerus bone, it is our upper bone. I'm taking the humerus bone, right? So this is the humerus bone. In the humerus bone, this end is called proximal end. Its opposite end is called distal end. Two ends are there. Proximal end is there. Opposite end is what kind of end? Distal end. Okay. In the proximal end, your syllabus has highly decreased in this area. There is a head region that you have to know. In the proximal end, there is a head region. Okay. So your book is pointing like this. The distal end of humerus has how many articular surfaces?
2.
Right. If you look at this diagram, you, although the names are not in the syllabus, okay, you can see two places called capitulum. Can you see capitulum?
Yes, sir.
Can you see the word trochlea?
Yes, sir.
They actually, that those words are not in your syllabus. Capitulum, trochlea. Okay, these words are not in your syllabus. If you get to know there are two articular surfaces, it is enough. Understood? I am putting that in the bracket just for an idea. In exam paper, they are not going to ask you what are the two articular surfaces in the distal end of the humerus. They are not going to ask you. Through these surfaces, okay, now we are going to see the knee joint, which not knee, elbow joint. Which joint you are going to have a look? Elbow joint. If you take the elbow joint, this is the elbow joint. Now you know in the forearm there are two bones. What are the two bones there? In the forearm there are two bones. What are the two bones there?
Radius and
Radius and
ulna.
ulna or ulna. Here, see, this is the distal end of the humerus. This is the radius. This is the ulna. So do you agree? Radius, ulna, both of them articulate with the distal end of the humerus.
Yes, sir.
Actually, radius is articulating with capitulum and ulna is articulating with trochlea. But that much of details are not in the syllabus. Understood?
Yes,
Understood?
sir.
So we are not telling in that detail. Here they say, through these two surfaces. What are those two surfaces? What are those two surfaces?
Radius and ulna.
No. What are those two surfaces?
Capitulum and trochlea.
Capitulum and trochlea. Radius articulates with
Capitulum.
capitulum. Ulna articulates with
Trochlea.
trochlea. And all these three together form the
Elbow joint.
elbow joint. Are you clear?
Yes, sir.
Right. Further, okay, when you come to the, okay, when you come to the other side, radius and ulna, radius and ulna, when you consider, okay, radius and ulna, if you consider, one thing you want to know about them is radius and ulna articulate with each other. There is an articulation between whom and whom?
Radius and
Radius
ulna.
and ulna. See here, this is the distal end. Are they articulating?
Yes, sir.
Yes. This is the proximal end. Are they articulating?
Yes, sir.
Yes. So, ulna and radius articulate between themselves. Further, ulna and radius, if you go to the distal end, we can come to which joint? Which joint? Wrist joint. Here, can you see the wrist? Can you see the wrist?
Yes, sir.
If you notice a broad part here, that is radius. And if you notice a small part here, that is ulna. Understood?
Yes, sir.
So they articulate with these bones. What are these bones?
Carpals.
Carpals. How many carpals are there? Count and see in the picture. There are 8 carpals there.
Yes, sir.
Right. So 8 carpal bones are there. Now they say they articulate with the carpal bones at the wrist joint. Ulna and radius articulate with each other at the distal and proximal ends, making radio-ulna joint. Right. You can see if you take radius and ulna. Between radius and ulna, other than between radius and ulna, other than they are attached to each other. In this place, there is something, right? Can you see? And according to your syllabus, that material is it's a fibrous connective tissue. What is it?
Fibrous connective
The
tissue.
fibrous connective tissue. Okay. And the shaft means the center part, are joined together by this fibrous connective tissue. So it stabilizes their association and maintain their relative position in spite of forces applied from the elbow or wrist. That means they will not be dislocated. They will be in the correct position. They are not allowed to transfer their position. That is done by that fibrous joint. Actually, it's a fibrous connective tissue. In the elbow joint, there are only 2 movements. What are the 2 movements? What are the 2 movements? Flexion and extension. What kind of joint they say?
Hinge joint.
That is also right. It's a correct word. Hinge joint. If there is a hinge joint, only 2 movements are possible. Now, take a laptop. In a laptop, there are 2 pieces joined to. Correct? You can move that laptop screen only in one way, right? You can open and you can close. Am I right?
Yes, sir.
Can you turn that screen to any direction as you wish?
Can't.
Can't. Same thing you can see in the door. if you take a door, 2 hinges are there or 3 hinges are there. You can move the door only in one plane. You can't change it. So those are the daily examples of the hinge joints. So our elbow joint is also what kind of joint? Our elbow joint is also what kind of joint?
Hinge joint.
Hinge joint. So because it is a hinge joint, only 2 movements are possible. One it is flexion, other one is extension. If you fold your elbow, that is flexion. Okay, fold. When you fold it, your palm will come near to your shoulder. Fold and see. Fold and see. When you fold it, your palm or your hand will come near to your shoulder. Is it happening? Is it happening? No? Can you understand flexion?
Yes, sir.
Right. So if you again bring it the straight form, you are performing extension. So only 2. Now carpal bone. If you take the carpal bones are actually in 2 rows. Carpal bones, although they are not regular bones, no a regular row. Okay, almost we can see 2 rows in it. This is 1 row. This is 1 row. There are, what is it? 2 rows in it. In every row, how many carpal bones are there?
Oh.
In every row, how many carpal bones are there?
4, sir.
4. These carpal bones are articulating with the metacarpals. These carpal bones are articulating with the radius and ulna. So there are 2. There is a distal row, there's a proximal row. Proximal row is articulating with the ulna and radius. Distal row is articulating with the metacarpals. Clear?
Yes, sir.
Right. So in the carpals, how many rows are there?
2.
What are the 2 rows?
Proximal row and distal row.
In these 2 rows, which one articulate with the ulna and radius?
Proximal.
Proximal. With the metacarpals,
Distal row.
distal row. And actually, between the carpal bones, there's a movement called sliding movement. It's a very limited movement. Okay, very limited movement. Right. If you look at this two hand movements, we will speak about it. And this note tells you the distal ends of radius. Wrist is present between the distal end of radius and three carpal bones. That's your note. So that is the truth also. Majorly, it is the radius making the wrist joint. Now, can you see this picture on the right side? Okay. In the upper picture, the palm is in what position? The palm is in what position? Up or down?
Up.
Up. Palm up. Correct? If palm is up, in Latin, this position is called by the name. What is the name given?
Supination.
Supination. Here in the second picture, where is the palm?
Down.
Palm is down. As it is down, it is called pronation. So, you can bring your palm to two positions. One it is supination, other one is pronation. When you see the supination, look at the ulna and radius. In the pronation time, look at the ulna and radius. In which one ulna and radius are parallel? Is it at supination or is it at pronation? Ulna and radius are parallel.
Supination.
Supination. In pronation, radius crosses the ulna. During this movement, radius rotates on ulna. Ulna will stay in its position. Radius will be rotating. So when you are moving your hand like that, it is the radius rotating. Clear? Are you clear?
Yes, sir.
So you can mark the details. Have you marked it?
Yes, sir.
So, in the wrist also, there is adduction, abduction, extension, flexion like movement. When you say tata, the way you move your hand is abduction and adduction. When some Swamiji say Santi, 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 he is moving the hand up and down. What is it? That is extension and flexion. Clear?
Yes, sir.
Right. So the proximal end of the metacarpals. Now, proximal end of the metacarpals, really they are articulating with the carpal bones. Okay, and the distal end of the metacarpals articulate with the phalanges. Metacarpal phalanges joint is a mainly metacarpal phalanges joint is a hinge joint, except the thumb. Except the thumb, other one is even thumbs one is a hinge joint. Hinge joint. Okay, the hinge joint, and in human, okay, you can see the fingers are showing extension, flexion, extension, adduction, abduction, and circumduction. Okay, adduction, flexion, extension, and circumduction. Okay, fingers may show this one with the first finger more flexible than the others. Our thumb finger is more flexible than any other finger. The thumb finger can reach the tips of each other finger in the same hand. The thumb finger's tip can reach each other finger in the hand. Okay, the thumb finger is placed at 90 degrees with the other fingers. This nature is called by the name opposable nature. Okay, with the tip of your thumb, you can touch the tip of your small finger, ring finger, middle finger, okay, forefinger, you can touch. That is called opposable nature. The perpendicular behavior of the thumb helps in it. Okay, opposable thumb can be noticed in all the primates, human, apes, monkeys, they have opposable thumb. Because of that, because of this opposable nature, in the primates, we can notice, okay, this action, power grip, holding any material tightly using all 5 fingers. Using all 5 fingers, okay, holding some material tightly without slipping, that is power grip. On the other side, in human, now when you are writing with a pen, okay, you hold the pen with how many fingers? You hold the
3.
Pen with how many fingers?
3 fingers, sir.
3 fingers. Right? That is called precision grip. 3 finger or 2 finger. Now, when you are inserting a thread into the eye of a needle, in how many fingers you will hold that thread?
2.
2. And that is called precision grip. Okay? Precision grip is a unique character for human. Other primates don't show precision grip, though they have opposable thumb. Okay? Opposable thumb, although it is there, they will not show that movement. Are you clear?
Yes, sir.
Right. Please go through the upper limb notes and tell me whether everything is clear with you. If it is clear, we can go across the lower limb. Your exam is further postponed. There's a story like that, correct? Not yet confirmed. Something they say November end or something. நிரந்தரம் இல்லையே நம்பிக்கை வைத்தாலே வாழ்வே சொர்க்கம் தான் கோபுரத்தின் கலசத்தில் எச்சமிடும் காகங்கள் ஆன போதும் சாமிக்கு வந்ததில்லை கோபங்கள் சில பூக்கள் சீரத்தான் வாழ்க்கை நூலாகும் மணி 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 உலகம்
Done, sir.
Everything is clear?
Clear, sir.
Right. Now coming to lower limb. In the lower limb, this is our the strongest bone in our body, thigh bone, femur, the thigh bone. The strongest and the longest bone in our body is the femur bone. They are humerus mean here femur. So how many femur mean one femur? This is our four leg. Okay. If you take it, there are two bones making it. There are two bones making it. One it is tibia, other one is fibula. One it is tibia, other one is fibula. Like radius and ulna, here tibia and fibula. Here in this place, the bones are tarsal bone. Tarsal bone. Carpal opposite legs having legs carpal bones are tarsal bone. Then these ones they are metacarpals. Here metatarsals. The tarsal bone. And here also we have phalanges. These are the phalanges. Could you please mark them down?
Done, sir.
Right. So in this place, there is a knee joint. Right. So this is patella or kneecap, a separate bone. So look at the diagram and tell me how many, okay, how many thigh bones, femur bones are there? How many
One.
femur bones? One. How many tibia?
One.
One. How many fibula?
One.
One. How many patella? Kneecap, patella?
One.
One. Okay. Tarsal bones are 7. Carpal bones are 8. Tarsal bones are how many?
7.
7. And metatarsals, they are same to the hand. Metacarpal, here metatarsal, how many? 5. And phalanges are 14. What is the total coming?
Thirty.
So total bones making the lower limb is how many?
30.
30. Could you please complete it?
Excuse me, sir.
Hmm.
If they say total bones that makes the lower limb, aren't we supposed to consider the 2 legs?
Limb, no, singular word, right?
Okay, sir.
Hmm.
Done, sir.
Sahika completed it?
Yes, sir.
Good. So, if you, hello? Can you see the head of the femur?
Yes, sir.
Right. Head of the femur is articulating with the acetabulum. Do you know this word acetabulum? Do you
Yes,
know
sir.
the word acetabulum?
Yes, sir.
Yes, today I showed you. It is the glenoid cavity in our hip. In the acetabulum, who articulates
Head of the femur.
head of the femur? What kind of joint they create?
Ball and socket joint.
Ball and socket. The same thing in the hand. What kind of ball and socket joint?
Incomplete ball and socket joint.
Incomplete ball and socket joint. Clear?
Clear, sir.
The thing it is it correct to have an incomplete ball and socket joint in your legs? In your legs?
No.
No. Why? Our body has to bear a heavy, our total body's weight is okay on that joint. Because we are standing, when we are standing, the total weight is bared by both those legs. If it is an incomplete joint, the joint will easily skip, it will easily slide, it will get loosened. Understood? So what kind of joint we have in the hip? What kind of
Complete
joint we
thoracic.
have in the hip? A very sturdy, strong, powerful ball and socket joint. And that is not necessary for our hands. Are you always bearing weight in your hands?
No.
No. So shoulder joint, it has an incomplete ball and socket joint. It can easily slide. It can easily get detached. But that kind of things will not easily happen in our shoulder because our hands are generally not lifting heavy weights continuously. Then you might ask, sir, what about the people who are lifting weights? Actually, in them, there is a great opportunity for the dislocation of their shoulder joint. Understood? Especially when the ligaments are becoming weaker, easily that joint will be. Now, if those people are not yet facing that one, mean their ligaments are stronger. If the ligaments are becoming weaker, they will be easily losing the location of the shoulder joint. Fine. And that is only for the people who are having heavy weight lifting, who are playing volleyball, that kind of thing. So our lower limb is helping us to be strong, to get a erect body posture. It is helping us to bear our body weight, and it's also helping us to walk. Okay. In the lower limb, various movements are there: extension, flexion, abduction, adduction, rotation, and circumduction. Like various movements are there, and how they are, it is shown to you here. Flexion, extension, abduction, adduction. Okay, rotation, that is internal rotation and external rotation are there. Okay, right. We have a knee joint, like elbow joint. There is a knee joint for us. In the knee joint, these two articulate. Okay, lower femur, tibia, patella. Lower end of the femur, tibia, patella. Only those three articulate. That means fibula is not articulating. You have to understand. Further, if you take this bone, this is called medial line. So, or we can call the body as this, okay, the line passing through the center of your body is median. In the two bones, it is tibula near to the median. It is tibia near to the median. Fibula is lateral. Okay, tibia is medially arranged and fibula is laterally arranged. That thing they want to tell you. Tibia is the medial of the two bones. Two bones mean of tibia and fibula. Who is medial to the near to the median? Tibia. Okay, lateral fibula. Okay, in the knee joint, okay, flexion is possible, extension is possible, rotation is possible. It is also a hinge joint. It is also a hinge joint. When this joint is locked, we have a chance of locking our knee joint. If you can lock your knee, you can stand upright for a long period of time. We can stand upright for a long period of time. This you can see in Army, Navy, cadres. Okay, now say they are going for a function. Okay, from morning to evening, they have to stay upright position in the parade. Until the whole event is over, they have to stay in the parade. They are staying without moving this side, that side, correct? And
Yes,
that is possible because the knee joint can be locked. Okay. When we bear a weight, the weight will follow or travel through the home. Which bone? When say you are lifting a weight or your body's weight, that weight will first travel through the which bone?
Femur.
Femur. Through the femur, it will get into the tibia. Through the tibia, it will get into this bone. That is our heel bone. We have a heel, no? Heel. The heel bone. Through the heel bone, it will reach the earth. So what are the bones taking part in weight bearing? What are the bones taking part in the weight bearing?
Femur.
Femur,
Tibia.
tibia,
Heel bone.
heel bone. Okay, heel bone. Here in the knee joint, who are the bones making the knee joint? Who are the bones making the knee joint?
tibia and patella.
Tibia, patella, and
Femur.
femur. In making the knee joint, do we notice a contribution of fibula?
No.
No. But in making the ankle joint, this is ankle joint. Okay. Fibula take part. Can you see the fibula in the diagram?
Yes, sir.
Can you see the tibia?
Yes, sir.
Can you see fibula and tibia are articulating with each other?
Yes, sir.
Right. Fibula and tibia will be articulating with a special tarsal bone called talus. But talus is not in syllabus. The special bone that articulates with the special tarsal bone that tibia and fibula articulate is whom?
Talus.
Talus bone. Okay, talus bone is not in the syllabus. Okay, but they say without using the word talus, how do they use the word?
A specific tarsal bone.
A specific tarsal bone. Without telling this is the tarsal bone, they don't want you to know the name of the the tarsal bone. So they are telling there is a special tarsal bone, with that only these two will be articulating and making the ankle joint. Clear?
Yes, sir.
So now in the ankle joint, okay, you can, using the ankle joint, you can raise your body, okay, in your tiptoe. Okay, can you understand that? Rising in tiptoe, unnurathu, unni paakkurathu.
Yes, sir.
That is rising in tiptoe. Second, it is lifting the toes towards the calf. You can fold your toes towards your calf, mean your leg muscles. Okay, the front leg. Okay, those two are the movements in the ankle joint. In the foot, imaginarily, the arrangement of the bones are considered into 3 arcs. How many arcs or arches? How many arches there?
3.
3 arches are there. What are the arches? Longitudinal arches and transverse arches. How many longitudinal arches there?
2.
2. How many transverse arch is there?
1.
1. Okay. Is there anything specially occurring there? No. The bones are arranged to create these arches. These arches are functioning as shock absorbing components because they absorb shock. While walking, we don't feel pain. Understood?
Yes, sir.
To maintain this arc, ligaments, muscles also help. Ligaments, muscles also help to maintain this arc. To maintain this arc, ligaments, muscles, both of them help. Okay? Right. So, please go through the content of lower limb. If things are okay, we will go to the diseases and disorders related to skeletal system. If we can complete that, okay, we can go for the movement. Still we are in the bones, no? Movement.
Clear, sir.
Fine. Now, what is the heading for you? Disorders and abnormalities associated with the human skeletal system. One of the problem is osteoporosis. This is the idea behind osteoporosis. Okay, there are two types of cells. Okay, collectively maintain the quantity of or amount of bone tissue or bone material. One it is osteoblast, other one is osteoclast. Actually, osteoclast is a kind of white blood cell. It's not a part of the animal bone tissue. Osteoblast is bone tissue component, but osteoclast is not a bone tissue component. It's outside the bone tissue, but it is helping to maintain the amount of bone matter. Osteoblast activity will increase the bone material or bone density. Osteoclast activity will decrease the bone activity. This is how they are maintaining the amount of bone. In people, like now say in normal person, okay, these two will be functioning accurately. In the people who are having a problem called osteoporosis, osteoclast activity will be highly increased. Osteoclast will be becoming hyperactive. Due to the hyperactivity of osteoclast, the bone material will drastically decrease. This severe drop in the bone matter makes the bone to become more porous, more softer, easily breakable. So it is easily breaking. That is the problem called osteoporosis. Your book is telling it like this. It is a condition associated with the reduction of the bone density. What is decreasing?
Bone density.
Bone density is decreasing. It is due to the exceedance of the bone reabsorption rate. The bone reabsorption is done by whom? Osteoclast. Over the deposition rate. Deposition rate is by osteoblast. So whose activity is increasing?
Osteoclast.
Osteoclast activity is increasing. It is becoming hyperactive. So bone quantity is decreasing. Clear?
Clear, sir.
Right. So the main now, if this one happens, okay, the joints will be becoming immobile. Okay, easily bones will be fracturing. Skeletal will become abnormal in their shapes. Bones will be creating severe pain. All these ones are symptoms of osteoporosis. Why osteoporosis? The major reason for osteoporosis is hormonal imbalances. Mainly compared to men, women are highly susceptible for osteoporosis. Women are highly affected by osteoporosis. Majorly at their menopause, when they are facing a hormonal imbalance. Okay, that is a highly risky period for them for osteoporosis. Although this is the main reason, they say calcium deficiency, certain environmental factors also can create, can develop osteoporosis problem. Although others can create, as I told you, the main component that does it is hormonal. What is it? Hormonal
Imbalance.
imbalance, right? That is, as it is, hormonal imbalance is very challenging. That is regarding osteoporosis. Okay, this is another one. Osteoarthritis. If it is this itis, okay, it can be translated by as inflammation. Inflammation is a swelling. Inflammation is a, what is it?
Swelling.
It's a swelling. Actually, in these people, right? This is the major idea. In these people, between the, can you see the left picture? It's a joint. In between the joint, there is a green color, a sheet-like material. Can you see?
Yes, sir.
Yes. So this material is the joint cartilage. It is the joint cartilage or articular cartilage. In our body, okay, due to a genetical reason, due to a, what is it? A genetical reason, antibodies start to degenerate these joint cartilages. Understood?
Sir, is it like autoimmune disease?
Almost like, but not exactly. Okay, that kind of a problem, right? Osteoarthritis. When osteoarthritis occur, okay, when osteoarthritis occur, the two bones are, when the cartilage is rubbed away, the two bones are rubbing with each other, and in that place the bone wastage occurs. Okay, the bone wastage occurs, severe pain is created. Through my studies, actually your book doesn't say it is autoimmune or anything. From my reading, I told you, don't take that one to your head. Okay, because if it is in the resource book only, you can get the marks. No, anything outside can give you a marks. Anyway, these things are told to you as the risk factors. Excessive use of affected joints. After they are affected, now in some people, their life will be somehow they have to walk now. They have to use the joints more and more. Okay. Some people's life it will be. We can't tell anything. Okay, easily we can tell you take rest, and that's nice. No, simply looking at a person, you take rest. If he takes rest, who is going to feed his family? Who is going to look after him? Do we have a mechanism for that? Nowadays, in Sri Lanka like countries, a person cannot even look after himself. Right. So excessive usage, mainly after getting affected, is very dangerous. Second, female gender. Compared to a male, you can see, have you seen the ladies wearing knee guard? Have you seen ladies wearing knee guard? Old ones, a brown
Like a
color.
band, sir.
Huh?
Like a band cloth.
Like a band, brown color, thicker
Yes, sir.
band. That is called knee guard. So very rarely we see males wearing knee guard, right?
Yes, sir.
Mainly female. Even my mother wears it. I took her to India for treatment. If she has gone for a correct treatment, it's okay. She has picked a wrong treatment pattern, and she annoyed me to take her there. So Mama's wish, no, whether I like or not, I had to take her. Understood?
Yes,
So
sir.
I took her nearly around 7 to 8 lakhs. We spent on it. She returned. She returned very happily, but I know it's not going to work out. Now still she is suffering. We have bought her a wheelchair, supporting accessories, and she is limited to her particular space in her movement. Those things are there. Third, it is age factor, aging. Fourth one, heredity. A very dangerous factor. Which one? And my favorite factor also. Which one? Heredity, genetics. If your parent has it, you will get it. And finally, obesity. Okay. Now in India, when we visited, my mother actually got it by heredity. Those people mainly treated for what?
Obesity.
Obesity. When my mother's body weight little decreased, she felt little comfort in moving her legs. Then she felt, now she has got cured. Now she is sitting in the room and blaming them. சொன்னது கேட்க இல்லைண்டா அப்படி. ஓகே, சொன்ன கேட்கணும். ரைட்? எந்த ஒரு மெடிக்கேஷனும் ப்ரூவ்ட் இல்லைண்டா எக்ஸெப்ட் பண்ணக்கூடாது. ப்ரூஃப் இல்லையா எக்ஸெப்ட் பண்ணக்கூடாது. ரைட்? இப்போ உட்காந்து ஏச்சு அவன் பொல்லாதவன், கல்லன், ஏமாத்திட்டான். I told her, she didn't listen to me. Right. So that is the problem. There's an inflammation, non-inflammatory disease, degenerative disease, non-inflammatory degenerative disease. Another thing, it is slip disc. You know, between the vertebra, there is a intervertebral disc. Do you know that one? Do you
Yes,
know
sir.
in between the vertebra, there's an intervertebral disc?
Yes, sir.
Yes. Inside the intervertebral disc, there is a jelly-like material. Due to this jelly-like material, that intervertebral disc is working as a cushion. Otherwise, it can't work as a cushion. It works as a cushion because there is a jelly-like material there. But sometimes this jelly-like material herniates outside and start to push the spinal nerve. Understood?
Yes, sir.
when spinal nerve is pressed, a severe pain will be created in that place and place below that part. For this one, majorly what people do is they take painkillers and tolerate that pain. But the proper treatment it is going for a surgery and cutting and removing this herniated part. Only the herniated part will be cut and removed. But unfortunately, that surgery, after that surgery, nearly 6 months to 1 year, that person should be completely in bed rest. He should be fully resting, not giving any strain to the spinal cord. Should not give any strain to the spinal cord. The problem it is for a multi-millionaire or a billionaire or a trillionaire, it is possible. But for a common man who daily earns his wages, okay, you stay 6 months in bed, you don't need to work me, he can't. Clear? Are you clear?
Yes, sir.
So the bodies of the adjacent vertebrae are separated by intervertebral disc. That intervertebral disc is working as a shock absorber. In the intervertebral disc, there's an outer ring of cartilage. In the center, there is a jelly-like material. Okay. In that jelly-like material is protruded out and pressing the spinal nerve. Okay, the protruding out is called slip disc, and it is creating pain, it is creating discomfort, spinal nerve is compressed. Okay, some places will be failing numbness, marathu pogum, feeling irukadu. In some places, most of the places, severe pain will be there. Severe pain will be there. So the main the main reason they say why slip disc means wrong method of lifting heavy weights. What is the main reason? What is the main reason they say for slip disc? Wrong method of lifting heavy weights. You would have seen people, okay, lifting weights, okay, weightlifting, right? This way, correct? They are lifting heavy weights. Are they getting slip disc? Tell me. Are they getting slip disc?
No.
No, because when they are lifting, they don't bend their vertebral column. They keep the vertebral column straight. And this is the squat position. Okay, staying in the squat position, if you lift without bending the knees, without bending your vertebral column, if you can do that, that is the best method to prevent slip disc. Without bending your knees, if you bend your vertebral column and lift it, there's a greater chance for slip disc. So enough for the day. Inshallah, tomorrow we will. Jazakallah khair. Assalamu alaikum warahmatullahi wabarakatuh.
Alaikum salam, sir.